Welcome to the EMU. My name is Noelle Stewart. I'm the Operations Manager for the EEG Lab and the Epilepsy Monitoring Unit here at the Johns Hopkins Hospital. My staff and I are here to assist you in scheduling your admission to the hospital, as well as answer any questions you have along the way. When patients come to the EMU, their hair needs to be clean and free of styling products. This includes braids and extensions. This is so the electrodes can adhere tightly to the scalp. Another thing that patients need to keep in mind is once the electrodes are on their head, they can't take anything off over top of their head, so their shirts need to either be button front or zipper front in nature so they can take them off more easily. And if they choose not to wear their own clothes, we can always give them a hospital gown.
When patients come to the Epilepsy Monitoring Unit, they have to have an electroencephalogram or EEG. And in order to do that, there are small metal discs or electrodes placed on the scalp. These are placed with collodion, which is a very strong adhesive. And the reason that we need to use this adhesive is because we want patients to have the freedom to move around the room, to move to the restroom, and to have the most comfort while they're in the Epilepsy Monitoring Unit. In order to do this, we need to make sure that those electrodes are very strongly adhered to the scalp.
While patients are in the Epilepsy Monitoring Unit, the staff can monitor their activity in the monitoring room. They can look at the patient's movements around the room as well as the EEG activity. If they find anything, they can let the physicians know to look at the record. They will also come in periodically to do some maintenance of the electrodes. This includes gelling and replacing them as needed.
When patients come to the Epilepsy Monitoring Unit and have electrodes placed on their head, we ask them if they feel that a seizure is coming on to push a seizure button. This button indicates on the record, on their recording of their EEG, that the patient feels something that is like their seizure episode, and that allows our EEG fellow, our attending physician, to look at the record and very closely scrutinize it to identify electrical activity from the brain that could suggest where a seizure is coming from, what type of seizure the patient is having. We ask patients to push that button as soon as they feel something similar to their seizure activity. We also ask that any visitors, guests, family members that are familiar with the patient and their seizures, that they push the button as well if they start to see a seizure coming on.